Renal anatomy. All right. Renal anatomy is a relatively easy topic to cover because you don't have to know all the specifics. All right. The first thing I'm going to be covering is the left renal vein. So the left renal vein is longer, okay, because it has to travel further to drain into the IVC. Okay, that's the first thing you have to know because the IVC is on the right side of the body. Well, like it's centered, but it's towards the right a little bit. So the left renal vein has to travel further to get and drain into the IVC. So that means that the left gonadal vein, okay, is going to drain into the left renal vein, and then all that blood is going to drain into the IVC because the left gonadal vein can't directly get to the IVC because it's too far. However, on the right side, the right gonadal vein drains directly into the IVC, and it does not connect to the right renal vein, okay? Very clear, straightforward. So you have an additional, the left renal vein receives an additional vein, which is the left gonadal vein, okay? There's another vein that drains into the left renal vein. It's not important, but it's the left suprarenal, okay? Who cares? I'm not going to ask you about that. Next is the glomerular anatomy, okay? What you need to know about this is that you have an afferent arteriole, which means that it's coming in, so it starts with an A. A is coming in, okay? And then an efferent arteriole. Efferent arteriole is blood that's leaving. So afferent arteriole has the blood coming in, efferent arteriole has the blood leaving, okay? At the afferent arteriole, you have the juxtaglomerular cells, and that's going to be the place that senses the perfusion pressure. And if there's a drop in perfusion pressure from the afferent arteriole, then the juxtaglomerular cells, the JGA apparatus, is going to release renin, okay? So it's perfectly centered so that it can sense the perfusion from the afferent arteriole. It's located right there. Okay. Next, that blood will travel through the afferent arteriole and into this location where it's going to be kind of butting up right against the Bowman's capsule. Okay. And between the Bowman's capsule, that arteriole becomes fenestrated. Okay. Meaning that it allows for fluid and different things to go through, not red blood cells. Okay. So you have a fenestrated capillary. And then next, you have the basement membrane. Okay. Which separates you from the Bowman's capsule, separates the arteriole from the Bowman's capsule. And then lastly, you have the podocytes. Okay. Which is on the Bowman's capsule side. All right. Then blood continues to flow out, and it will flow and leave via the efferent arteriole. Okay. And then that fluid that enters the Bowman's capsule is then going to go enter the kidney system, and we'll talk about the kidney system later on. But all that occurs is really Bowman's capsule is going to go to the PCT, the proximal convoluted tubule. It's going to go down the loop of Henle, then it's going to hit the loop of Henle, and it's going to go up to the ascending loop of Henle. Then it's going to hit the DCT, which is the distal convoluted tubule, and it's all going to drain into a collecting duct. All right. So that's kind of what we're going to be talking about. Lastly, the anatomy that we care about is the ureter anatomy because the course of the ureters are very, very important because in surgery, they get nicked a lot. So if you don't really know the anatomy of the ureter, you're going to actually potentially nick the ureter and cause some problems if you're doing surgery within that region, okay? So what we have to first know is that it's going to go over the common iliac artery, and it's going to go under the uterine artery or the vas deferens, depending on if you're female or male, okay? So the way that I remember it is that, I mean, and they say it in there, but water flows over the iliacs, so over the iliacs, so over the common iliac artery, and under the bridge, which is just the uterine artery or the vas deferens, okay? And what happens is during gynecological procedures or anything that's occurring within that pelvic region, if you ligate the ureter, okay, so if you actually accidentally nick the ureter, you could get ureteral obstruction or leakage, which leads to an overall decrease in your glomerular filtration rate, which is your GFR, and a decrease in your filtration fraction, your FF, because all that urine starts to back up, okay? So you get a decrease in GFR and a decrease in FF, filtration fraction. Lastly, to understand the blood supply of the ureters, you have to understand that it's such a long structure. So depending on where you're at, it will depend on your location. So the proximal area of that ureter, okay, the closest to the kidney, is going to have blood supply from the renal arteries. All right? Very easy, straightforward. If you're going to have a proximal ureter question and they ask about the blood supply to the proximal ureter near the kidney, the answer is going to be the renal arteries because that's the same location. It's very close to it. Okay? Distally, I don't care really much about the middle because there's so many blood supply to that location. And then distally, the distal ureter gets it from the internal iliac and the superior vesical arteries. Okay? Relatively lower yield. I think I saw like one question on it maybe. But know your proximal blood supply and know the course of the ureters. The course of the ureters is very, very important.